Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Jennifer Thomas, and she's the Community Health Manager at Mercy Fort Smith. Jennifer, thanks for being here.
Absolutely, no problem.
So we're talking about community health workers, and tell us first, what are some of the biggest challenges currently facing the Fort Smith community in regards to health?
So the biggest challenges right now, I think we are working with are going to be maternal health, because Arkansas is top in the nation for maternal mortality. And so that's something we're focusing on. Mental health, of course, is very much a top priority for us in Fort Smith. Also poverty and our social determinants of health. So poverty, food insecurity, unable to afford medications is a big issue right now. So those are our top things that we're looking at trying to have programs to address.
And that seems to be really trending across the state and not just Fort Smith.
Absolutely.
So how does Mercy Fort Smith approach building partnerships with local organizations and agencies?
So I am a member of many health councils, coalitions, and so I try to spread the word about community health, what we do. Also, we just finished up our community health needs assessment. So we will take that and start working on our community health improvement plan, which is our CHIP. And so we are looking for our partners to be people who could help us address those top priorities, which are mental health, maternal health, obesity, diabetes. So those top priorities are things that we want those organizations to help us address and help create programs for. And so that's what we look for when we are trying to partner with organizations. Are they going to be able to help address those needs?
Is that schools, nonprofits?
Schools, yes. So we have school-based clinics. We have nonprofit organizations like 100 Families, Next Step Homeless Services, Hope Campus. There are just so many that help out with our CHNA, our Community Health Needs Assessment. So many different types of organizations. Absolutely.
And what roles do your partners typically play in delivering health programs or services?
So we kind of think of it as a wraparound. As Mercy deals with the medical care of our patients, we look for organizations that can help with, food insecurity. Can they help with maybe homelessness or housing, things like that. So we try to focus on the medical when we ask for other people, like, the mental health, like Gateway, or, things like that that can help with the other, or, with other health needs.
What outcomes or improvements have you seen as a direct result of these collaborations?
We have seen the results from our uninsured residents or patients having insurance now. They're able to access mental health services, the housing. We're able to, give them housing vouchers or food vouchers, or assign them a PCP. So those are things that are trending up because of those partnerships.
And how do you measure the success of a community health partnership? And it varies.
Yes, it varies. So I always look at the amount of referrals we're getting, the amount of new organizations that are reaching out to me and saying, I heard about you from 100 Families or from Gateway. And so that's how I know that the word's getting out. We are helping those people. And I feel like we're constantly adding new organizations kind of to our partnerships, because they're constantly reaching out to me and asking, like, how can we partner with you? We have clients that need your help. How do we work that? So I'm hoping we can grow our community health program and have more community health workers, because there is definitely a need.
And you mentioned are there any new or upcoming initiatives that you're excited about involving community partners?
Definitely would be the community health improvement plan. So like I said, we just finished up with the CHNA. So now I'll be working on finding programs that will address those top priorities that our community, we did a survey, and our community said, these are the things that we want to see addressed in our town, in Fort Smith, and also in our rural areas. And so I am very excited to work with our partners to find programs that will address those needs.
And how can other organizations, individuals get involved in supporting your community health efforts?
I would say join the Fort Smith Health Council, join the Opioid Summit, join 100 Families. There are so many different organizations and alliance meetings and health councils that people can join, or they can just reach out to me and say, hey, how can we work with Mercy Community Health to, address our clients and help our clients? So that's always an option too.
And you've touched on these a little bit. Can you highlight any successful community health programs in the River Valley and share some of the measurable impacts they've had?
Definitely. Well, I think the community health program that we have at Mercy is the one that I can speak of course, the most. I did a little research and some data that I pulled, and we were able to assist over 2,000 patients in 2024. We gave over 1,500 community resources out to our patients. We assigned 311 PCPs to our patients, and we applied for Medicaid for over 800 patients. So that's the biggest one that I like to brag on is our community health workers. They're amazing.
And what lessons have you and your team learned about working with diverse communities in the River Valley? I mean, what are some things that you want our audience to know?
Listen more, talk less would be my very first lesson that I've learned. Just getting to know the person first. What is their culture? What is their background? What is their religious beliefs? Because that definitely affects how they deal with their health. So I think that was the first thing for me was just really listening. And letting them trust me first, getting their story, letting them trust me so that I can get to the root cause of why they're in the situation they're in and how can we best assist them. Also, helping them to advocate for themselves and for their own healthcare, because once we help them that first time, we have to kind of go to our next patient. We have so many patients to help. So how can we set them up for success? So that's a big thing for me is asking those questions. How can I best help you so that the next appointment you can make yourself, or we don't have, what can we do to help you? So I think that's the thing, listening, getting to the root cause of it. How can we best support that person?
And as we close, tell us what you want our audience to know about the programming. How do they get plugged in? Where do they go? Is it a website? Is it social media?
Just call Mercy, ask for community health. They're going to get me, and I'm going to assign them a community health worker. And we are going to do a screening of them and ask them all the questions. How can we best support you in getting you healthy? Would they come into Mercy for the emergency room where they see their primary care physician? They can ask their primary care physician. They should be asking those questions in those appointments. If someone says, I'm having a hard time paying an electric bill, or I haven't been able to, purchase my medication. That's why I'm back in the emergency room. I think we have a really good system where we are screening those patients and they are getting to us. But if you're just out on the outside and need to get in, all you have to do is call Mercy and ask for community health.
And what is the message that you want the PCP, the healthcare provider, to know about the services that you all provide?
We're here to help. And so if someone isn't able to pay their bills, if they are not buying their medications, if they do not have transportation to their appointments and they're missing a lot of appointments, if they are underinsured, that is something we can look into. Why can we help them get more insurance? Is there another coverage we can get them? So I think anytime they run into a problem or they're hearing a problem that's affecting their patient's care, they should be reaching out to us and saying, how can we partner with community health to address that?
Well, Jennifer, thank you so much for talking about this the important work that you're doing in the community. I appreciate you being here today.
Absolutely. Thank you for having me.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.